So morning sickness or nausea and vomiting of pregnancy is a very, very common condition. Almost 50% of women will have it significant enough to affect their life. I was fortunate, I didn't have very bad nausea and vomiting, especially in my second pregnancy. So it can vary from pregnancy to pregnancy as well. But it can certainly make the first few months quite miserable for a woman, especially if a lot of vomiting happens. The changes are because of a lot of hormonal changes that happen in my pregnancy. And I keep telling my patients who feel so miserable, Lynette, that if you don't even have nausea and vomiting because you don't feel the baby move, you don't have any other symptoms of pregnancy, you will forget that you are pregnant and you will just do things that you are not supposed to be doing or eat what you are not supposed to be eating. So it's nature's way of reminding you that there will bun in the oven.
Yeah, I agree. So actually when I had nausea for the first trimester, I was very happy.
Yeah, actually patients do say that they feel that, because nausea is there, that the baby is okay.
Yeah, so I feel like, I have enough hormones and it's keeping the pregnancy going well. But as you said, it was miserable. I couldn't even brush my teeth.
Yes, a lot of patients do say that.
So, don't worry, you don't have to feel guilty. So when you can, you keep to oral hygiene. When you cannot, it's okay to just rinse with water, especially after you've vomited. There are a lot of patients who think, I vomited, there's, acid in my mouth, I need to really brush it away. So that's not accurate. It would be better to wait at least an hour, and then the saliva neutralizes everything, then we brush. And the other thing we do recommend, if you can, instead of water, to rinse with a fluoridated mouth rinse.
Oh, nice. Yeah. I didn't know that. I will certainly advise my patients. Okay, so pregnancy cravings, that's the other thing that women talk to me about and husbands complain to me about. But cravings are also because of hormonal changes. They are because body is going through a big change, the taste glands, everything is changing. Some women, they complain of having a bitter taste in their mouth all the time. Others yearn for very strong flavored foods. Right. Did you have any cravings when you were pregnant?
Well, to me, pregnancy craving is an opportunity to feel like a queen. So you have to torture the husband a little bit.
Indeed, that's what their husbands complain about.
So I was lucky. I didn't really crave a lot of sweet food. I didn't really crave a lot of food, but I did crave spice, which I normally don't take. So a lot of prata. Yeah.
Nice.
But I mean, a word of advice for women. I know a few of my friends, when they were pregnant, they would crave a lot of sweets. So you don't have to feel guilty. I think a lot of pregnancy sometimes is, you read a lot and then there's a lot going on the internet. And then there's a lot of guilt.
That's right. That's right. Mother's guilt.
Yes, but I mean the whole point is, you have a little baby growing in and it's a lot of joy. So I think it's important to enjoy the journey. So if you do have, sweet food craving, it's fine. You just have to switch to, let's say, dried fruits.
Yeah.
I took a lot of bananas. I heard that it also helps with morning sickness. I'm not sure. Not so much.
Not so much. Yeah, different people are different. You really have to figure out what works for you.
So I was into like dried apricots.
That's nice.
And figs. Yeah. So that's a way. I mean, you can still have your sweet, but find healthier options.
Absolutely.
Yeah, and then remember proper oral hygiene. Yeah, and again the fluoridated mouth rinse.
Absolutely. Now, certain things, if you have a craving for, say, example, soil or eating chalk, then those could indicate that there is a deficiency in your body. For example, of calcium, which we know that a baby is using a lot of calcium from the mother's body. So if there's not enough calcium in the mother's diet, then the baby will take what it needs, and then the mother's bones, etc., will be deficient, and she will then want to crave for all these chalky or soil kind of things.
Okay.
So if you have very strange cravings, then do see your doctor and report these, because certain blood tests can be done or certain supplements can be added to the diet to fix that.
Okay, that's good to know.
So every pregnancy is unique. my two pregnancies, my two kids are different, and the two pregnancies were as different as chalk and cheese. Words of advice for young mothers to be: enjoy the journey. You will miss the time when you felt this little baby kicking inside your womb, because before you know, they will be teenagers, slamming doors and whatever not, rolling eyes at you. So enjoy this journey. Enjoy every stage of pregnancy, of motherhood, and after. It's a journey. Children are an absolute joy.
Yes, I agree. I think, I love being pregnant. But a lot of pregnancy nowadays is a lot of, I feel, pressure on the mummy. And, the journey should be enjoyed. So as much as, the books say to do this, or Google says you should do this, you should do that, in the totality of it, a lot of it doesn't really matter. A lot of it is time with, your child, enjoying the whole process and the journey. So, I think motherhood is very rewarding.
It is very rewarding.
Despite the hardships.
Yes, despite the hardships, that's the key there.
Right.
So to all young mothers there, we wish you all a very happy Mother's Day.